Well, hello and welcome to Infusion number 2 video of Chronically Happy. I'm also going to be doing some unwind with me as it's like 12, it's going to be after 12 when I get done infusing. So it's time to get everything all ready and set up and start to infuse. I finally finished my paperwork for the most part. I did a lot of things I need to get done, which is not long. That stuff is just piling over. I can't deal with laundry today. I've got to get infused, and I need to get infused now because it is 10:30 at night. And I can't do it in the morning. I need to get some better lighting in here for my recording here. I have a ring light, but I don't have it here in my bedroom. I have it in storage somewhere. So just trying to get the right lighting. Have it there and laying up on my bed as per I would on my desk. I recently changed everything, but I'm gonna have to be laying down during a lot of my infusion because I just can't. That's my sharps container, my pump, trash can, water and everything. Get this stuff going. All these baggies. As per my directions on how to do my infusions, also somewhat sanitary surface here, which I have a sealed drop box to put everything on that has been unopened. So I'm going to make sure to have my gloves out and everything ready to go. I'm not touching my face too much. Oh, my face itches though. I got my sanitizer in here too somewhere. Alright, let's get all set up. Got all my supplies ready to go. Here's my directions. The paper directions. There's my pump. Get that all ready to go out. Pump is ready to go. Set that on that table. That's off. Alright, we got all the boxes of medicine. I got a big towel grate because I'm going to need that. Put that in there. I gotta get my booklet ready. Gotta get my pens. Alright. It's a lot to prepare for. Maybe I get another angle here. Angle for all this. I'm just trying to get like an overall angle of how much I have to set up. Maybe I can get that set like that so I can show as I'm laying it out. Alright. I'm recording, so I don't want anybody disturbing, so I'll shut the door all the way. Alright, we got the cap. No cap, yo. Cap. to get everything here. Dose number 5. 5th. Don't have any of that. I am going to be infusing my stomach. Even though I have this tape here, I'm going to have to just maybe go a little higher. I'm not sure. But I'm not going to have anything laid down until I open this nice and non-contaminated drop towel. I gotta make sure I have all my supplies out first. So I need 1 flow meter to check. The rest can go back in there. I need 2 syringes. Check. Realistically, I can do it in 1, but last time I tried to do it in 1, I screwed it all up, and I'm not doing it again. So, we got 1 set of 4 needles. Check. Face and everything is so itchy. Alright. Now I need to save my box lids for the nurse, I believe. So I am going to save those for her. Here's one. I don't know what happened to the one that I messed up my dose on. I think I threw it away. I don't know. All I know is I didn't do anything correctly that day. And I'm just making sure that I'm not messing up the lot number this time, because last time I tore the box and I didn't do anything good. All the lot numbers. Save those. I need to put them in a Ziploc somewhere. I need to put them right there. Stupid nose tickling. I'm going to sleep really good tonight. That's all I know. Alcohol. I'm going to go wash my hands really good before I do anything as well. Before I open up any of this stuff. But in the meantime, I'm just going to sanitize, get what I can. Tonight's garbage night as well. So I canned to the curb, and I kind of need to empty my trash can again, because I just created a whole bunch of new garbage right now. We got alcohol prep pads. Multiples of those. We're going to need lots of those for my stomach and stuff. We got that cut out. We got the tape. Okay. Put all this aside so I can put my drop towel on. I got those. I got the syringes. I need to do my blood pressure. I need to have gauze pads for when I'm done infusing. 1, 2, 3, 4. I have way too many alcohol prep pads, but that's okay. It's okay. One more syringe cap. These are fine as long as I don't take any of the cap or anything off yet. They are fine and sanitary. The smell of medical supplies. So fun. Oh my gosh, can this other trick open or what? How is it difficulty with that package? Stupid. Get in there. Just like the Mortal Kombat. Finish him! Yeah, finish that package, man. Alright, got all that packaging taken care of. Now I need to affix my labels of my medicines, my booklets. to move these too much. I don't want to create bubbles, which creates bloating when it gets into my subcutaneous layer. And people are like, oh, it's fine, it's fine. No, dude, I don't want extra bloating. I already got extra bloating and swelling. Alright, so we got all those ready. I got the flow tube, that flow tube, those alcohol wipes, that for the gauze. Where's the gauze? Right there. Alright, now it is time to make sure everything is sanitary and do my washing of my hands. So I'll pause and do that. Alright, I just washed my hands. I'm using paper towel to dry them off. I'm now putting my gloves on. So hopefully everything is still kind of sanitary. Oh, I hate when my hands are still partially wet. Dry the hands off. Dry the hands off. It's hard to put latex gloves on when your hands are a little wet and damp. Oh shoot, that was worse. Alright, now let's put this one on. Alright, now we're going to put down my sanitary towel drape. So I can put all of my stuff on top of it. Close my door again, because my dog will definitely push the door open. Because she likes to see the door open. She don't like it closed. Go figure, like any dog. Alright, we get my syringes on that. All of this on here. Alright, now we can open up the flow meters and flow things. See how long it takes me to prep this? It's already been 12 minutes and I am still prepping for doing all of the infusion. I'm betting by 11 o'clock tonight I will be started. Ortagaderm. Now I need to get these little paper things off. Those. Needle sets are all taken apart by the paper. Alright, we got my flow meter. I'm going to attach it to my needle set. Hello, where are you, thingy? Oh, there you are, right there. Alright, there's all the needles there. Now I need to get to my flow meter onto the flow meter end. Is it this end or this end? We're about to find out. And do not touch any of the parts to the parts. So I got the needle sets in my hand. And this is how I had to screw on the flow meter, the flow rate tubing to the needle set. So flow rate tubing, a small one, needle set, long, lots of them. So it was just a matter of taking this and screwing this together. And this is the vital piece to my infusion. This is what controls how fast it is injected into these 4 tubes that inject into my skin. So right now I am going to clip off the flow meter tubing, and then I'm going to clip off the needle sets at the very bottom. Got a Doug song stuck in my head. I didn't even watch that Nickelodeon Doug show very often, but that song is flipping addicting. I will listen to that over and over again with my ADHD autism. On repeat. Alright, now let's get to that. My tubing done. Now it's now getting the medicine into the injection syringes. Remember, do not. It smells like saline to me, or like a saline bag. I get that taste in my mouth when I have. I'm putting this on the tip here, just so it's not getting contaminated while I do the other tube. And this is the one I am going to start with. And I need to pull it back, push it forward. Okay, good to go. Now I need to put this on. Screw that on. This is what helps put the medicine from the other syringe into this syringe. Where I made the mistake last time is I had this plunger pulled all the way out and I pushed the medicine in, pushed the medicine in. I went for the third one and then went at the bottom. I still haven't posted that video, but I do plan to do that. Maybe I'll do that after posting this correct video. I said that the last time. Alright, so the main thing is, before putting the medicine inside the loading syringe, is making sure to hold it up to the light to make sure it's not cloudy. Make sure don't see a whole bunch of bubbles, see anything like extra floating around. So I'm going to go inspect all three of these in the light because it's dark inside my room. Okay, they all look really, really well. So I am going to go one at a time and put them into the loading syringe. So I take that cap off, this cap off, put this in, turn it until it clicks in, and then I just push the medicine into the syringe. Boom, there is one. Okay, now I need to get the next one ready. Turn this guy off. Turn this upside down. Turn it on. And then inject into the syringe. And that is all I'm going to put on this one. So now I am going to just unwind the flow thing and put it on this other syringe. After I take this off, I'll go directly from here to here without touching anything. And then I will also put this thing back on until I'm ready to do that medicine. So that is sitting there ready and waiting to go. And now this is my last medicine. I do have a little bit of air in my syringe. I am going to have to undo and push in so I can push this all the way in. Okay. Oh, that was already, that syringe is already pushed in. What am I thinking? Okay. I'm tired, guys. I'm tired. I just didn't want to open up too much for contamination in the air. last syringe of medicine into the loading syringe for the pump. That is now complete. And now I just need to attach this to the flow tubing. I'm going to do the smallest syringe first because that is what I think is better. I would rather change it out sooner rather than later. Unscrew the flow meter and then screw that on. Great. Now I have everything ready from the flow tubing, the medicine, the flow tubing. I have it pinched off. I'm going to unpinch this part so I can let the medicine flow freely and try and get it pushed into more of the bottom of the needle. I can watch it go down into the other tubes. This part takes a little bit. But what I like to do is, so it's not all the way primed yet, but I don't want the needles to drop down here, so let me hold on to those. So the needle has to, the syringe, loading syringe has to go in as like that, and then you just turn it, and then it's in there, and then I keep spinning this until it clicks into place at the very end to let me know that it is at the syringe. And it is now pressurizing the meds through the tubing. I better hurry up and get these needles set up and get my area primed before it gets to the end. I gotta get all these clips off these needles. All this stuff put away. Alright. Now I need to okay, these are all clamped off. I should not be getting medicine to the tips yet. I'm going to turn on my extra lighting. It looks bad in here. Sorry for the recording. I'm going to turn it back off when I get the rest of this stuff ready to go. I just got to make sure I can see the needles, make sure I'm not wasting any medicine coming out the tips as I get my skin ready to be poked. Alright. So first thing I need to do is prepare my injection sites, which is my stomach. I have to make sure that each needle is about 2 inches apart. Come on, stupid alcohol prep. Alright. I can do one right there. Oh, I need Tagaderm ready. Tagaderm, you gotta be ready so I can put the needle in. Tagaderm, you're my hero. Alright. Let's lay down there. Let me alcohol prep again, just to make sure nothing unsanitary happened. Make sure I have the right spot. Okay, that's right at the waistline. That's going to be fun. Got needle number 1. I gotta pinch the skin. Pinch it. Take the butterfly needle and go right straight in. It always scares me. Alright, That one felt like some nerve bundles. Awesome. Tag derm in place. Alright, now paper off the tag derm. Alright. I can allow the medicine to go in that one if it wants to. Alright, there we go. There's one. Alright. Next injection site. I'm going to go right above it, about 2 inches. Kind of a harder setup not having my table, so we're going to go about 2 inches. I think that's about right up here. Okay, needle number 2. Oh, Tegaderm. I always want to forget the Tegaderm. Alcohol pad stuff. My drop cloth all wet. Tegaderm, be ready to go. That's trash too. Oop. All right, now next needle. Which one do I want? I want this one. I'll unclamp it and move it away so I can just get the needle in. Do another alcohol prep just in case I got more bacteria landing on my skin in a matter of minutes. Who knows? I can never be too cautious. Alright, here we go. Next spot, 2 inches. Oh, I went sideways. Ouch. Try again. Try again. Ouch. Medicine's already coming out this one. I gotta pause it. Pause it. Pause it. Clamp. Clamp. Oh, that hurt. Oh, I went sideways. I went sideways on that guy. That was a bad spot. We'll go above. We'll just go straight above. Screw it. I hope that's 2 inches. I don't know if that's 2 inches. It's close enough. Alright, now I can unclamp that one. Unclamp. Alright, we got 2 more to go. 2 spots down, 2 more to go, guys. Tegaderm. I don't think I want to use that. Alright, let's sanitize my gloves since I touched the floor. New Tegaderm. Alright, alcohol prep pad again. That one didn't hurt at all, man. Alright, one more to go. This guy's unclamped. Now we got one last needle set. It is all wrapped up and what the heck? Why is this one? Oh my gosh. This one got into a knot. Well, that's stupid. I got a knot in my freaking tubing. There's nothing I can do about it. Nothing. Alright, alcohol prep pad, Tegaderm, last site. I just don't know how to put that last one with this tape here. You're messing up my infusion, man. I don't know where to put it. Right next to my belly button, I suppose. Tegaderm's going to have to go over the black tape. That one felt like it's going to bruise too. Okay, unclamp. Okay, everything should be unclamped. Everything should be infusing. I mean, this thing is at top. Like, I can't turn this sucker anymore. I see it infusing. It's going. Alright, it is 11 o'clock. 11 p.m. I am starting my infusion. Whew, alright. So that's me all hooked up for my infusion number 5. And I guess I need to hold this upside down. Do I let gravity to help do things? So that took a total of 35 minutes in order to get all ready infused. Or start infusing. Whew. Man, that wasn't without some technical difficulties there with a couple things. Look at this mess on my bed, guys. Like, look at all this stuff. Like so much stuff, man. I got so much waste. Just got to get it all in my trash can. Get this lighting better too. So I need to write down the time. It's at 11 o'clock is the start time. 11 p.m. on the dot. All right, now time to clean all of this up. What a flippin' mess. Extra taxiderms. All of these need to go in the trash. These need to go in the trash. Oh, jeez. Those need to go in here. Trash can. And my little teeny trash can is all full. We'll put the gloves, sanitizer, straight towel, and I guess with the straight towel, we'll put the alcohol pet pads and the gauze. This can go in with the extra taxiderms. Don't need any more of them. I got my gauze pads. I got this. I have my instructions put here. And then this stuff. Fill it up and put it inside this thingy. Should be organized better. Yeah. Throw these suckers in there. Get in there better. Turn the direction you need to go. Stuff. Get in there correctly. Turn. Thank you. Ugh. It makes me so flipping difficult on myself. I know how to Tetris, alright? All that stuff, and then extra baggies. Now, all I got left is my last big syringe of medicine. I got the gauze pads. And I got the tape for the gauze pads. I got this. I got my monitoring device. My sharps container for afterwards. My stapler back in here. Alright, I am just going to shove this little guy over to the side here because I want to lay down because my back really hurts right now. If I can get all these supplies put away. 40 minutes, guys. Look how long that takes. 40 minutes just to get all started. Oh man. How much medicine do I got left now? before I gotta swap out freaking syringes. Because this guy should go pretty fast. I've got 10 to go. This thing is as tight as it can go, so it just needs to finish and it just needs to infuse that 10 milliliters. No clamp, no clamp, no clamp, no clamp. They're all good. Alright. Alright. Oh man. Let's do my blood pressure and my temperature and log that information. That's probably the most normal I've ever seen my temperature. 98.6. 98.6. Temp. Start. Alright, now let's get my cuff going here. Got my blood pressure. Don't cross the feet. Alright, let's get this going. (101 over 63). Pretty darn good. 101, 63, pulse 69. Alright, cool. Got all my initial checks done. Got everything infusing. I'll do that after I change it in a little bit. All right, now, I just wanted to share with everybody that I got my computer chair so I can get my work done in. And earlier when I was, took my thumbnail picture, it's been quite the week, guys. I just got some test results of my IGG panel. So my infusions are working. They have increased my IGG subclass 2 numbers. I'm no longer deficient since I started therapy. However, I have high IgM levels, which means either an infectious disease or acute disease infection. It can mean autoimmune disease, a very inflammatory response disease. It can mean cancer in the bone marrow. And I've been kind of having some weird numbers lately in some of my labs, so I've been kind of keeping an eyeball on them all. I am kind of concerned about learning about my IgM levels within the last hour. This is what delayed my infusion today, is I was doing all my admin paperwork and stuff, and I came across a email saying, hey, your lab results are ready. I'm like, oh great, I'm happy to find out my IgG levels again. Yeah. My IgM is high, and that's not good. I'm a little worried about that. I don't see my immunologist until February 11th, and that's some BS, man. I might have to actually see the PA ahead of time, but my appointment on Friday is with a new dermatology immunology clinic, and so I'm hoping that I can get matched up with a good dermatologist immunologist, and I don't ever have to go back to my immunologist that got me started on these meds. I can't handle them not doing their damn job. I had to have my primary care physician order this panel in order to continue to get this authorized, and I still meet the requirements for treatment. I'm going to be listening to an audiobook, I think, after I'm done recording and I go to post this video. Let's see, check my levels here. I hate having it in this stinking thing, man, because I can't see it very good. I like to know exactly where I'm at with my medicine at all times so I can just swap it out immediately so I can get this damn thing over with. But it's slowly moving. It's moving very slowly. It has so much more to infuse. I have another 40 milliliters. So I have this much more to infuse after this one's over with. I just want this to be done so I can swap needles and I can just chill and lay here and probably doze off, honestly. I'm so tired. I spent so long organizing all my paperwork. I have 11 pages of paperwork that I did today. I'm so proud of myself for catching up. I think there's a couple of things I miss. I didn't completely change like I needed to, but it's as close as possible. It has the best of information of everything that I need, so I still need to get back to my dentist office about getting my filling. I have decay down in this tooth down here, and I have an appointment with an orthodontist here coming up soon, beginning of February, and that's going to be fun. I'm going to try and maybe get some Invisalign on my bottom teeth. I'm also going to try and get a surgery if I have enough substance to be able to do it, but having a connective tissue disease, I don't know if it's going to be really beneficial to do or not. It's something I'm going to really have to discuss with the specialist and see what they can do, the oral surgeon, about my receding gums. I'm trying not to lose my teeth, and I was about to get a filling and just found out that United Healthcare is no longer covering fillings. So I have to get a hold of United Healthcare and find out what kind of dental coverage there is to see what's even worth it. I might have to change plans, and I don't want to change plans because I already am rolled into 2025 with things already going on my current plan. And if I change plans, it might mess up other things, and I really hope not, but gosh, we'll see. I don't even know how much this dermatologist is going to cost me on Friday. I'm going to have to try and see if I can get billed for it or something and not pay up front, but specialists all cost like $35, I think. Let me look at my United card. It's a new card, so specialist, yep, $35. So I need to have at least $35. I am getting broke as F. I can't wait until payday in 8 days from now. It is so hard being chronically ill and having all these copays and seeing all these specialists and changing specialists because one office are idiots and they can't do their damn job. I had to get my primary to do their job for them in order to keep my insurance going with these infusions. So disgruntled about it. I'm so disgruntled. Just want to... It's like, get your crap together, man. So frustrating. Here's my infusion. My infusion. Infusing. Oh man, I'm so ready to go to bed. I've been functioning on my Xanax and Klonopin all day today. And don't do as I do. Do as I say, not as I do. I'm not supposed to take them at the same time, but they are my pre-meds in order to get these infusions to keep me from flaring really, really hard. So I can already tell that my swelling is starting to go down in my face a little bit. But with how much inflammation I've had today, oh my goodness. I have no idea what the x-rays are going to show tomorrow. I can't wait to find out. I can't wait to see these x-rays. I can't wait to get more imaging. I can't wait for my doctor on Saturday to order more MRIs. And the VA is going to pay for those. And then I can get those MRIs to the neurosurgeon. I can get a referral to the neurosurgeon after I get these images. You know, I've stepped away from my Ray family chat. I really needed to just step away and take care of myself for right now. I have so much going on that, you know, I just can't be a part of something that is so wonderful, but also distracting. Where I feel like I need to respond and catch up on. It just gets to be a little overwhelming. I was an admin, and I loved being an admin. Don't get me wrong. I wanted to be an admin of a group for once in my life. But I couldn't keep up, and you know, I eventually plan to go back. Right now, I have way too much stuff going on, and I don't want to lash out. I made a fool of myself. I lashed out at people. I made a fool of myself in front of a new person. I feel totally embarrassed, and, you know, there's still cracks. There's cracks. They've been glued and put back together, but there's still cracks. And, you know, they're repaired, but they're always going to be there now. And that first impression was a horrible one, and I was very homophobic, I guess, in a comment that I made, and I'm not homophobic by any means. Like, I didn't mean it. It was kind of a aggressive joking around, and the new person mentioned something about being like, not necessarily saying that they're non-binary, but they weren't identifying as a woman or man. And so I made the comment, so are they a he or a she? And that really hurt several people's feelings in the group. And I didn't mean it intently, as in like, they were joking back and saying, I could be whatever you want kind of thing. You know, it was a flirting, it was a whole conversation, but it was very disappointing to several people. Well, according to one person anyway, but I'm sure she was talking on behalf of a couple other people in the group too. I seem to rise a commotion and then I leave. Well, out of my own mental health, I had to leave so I can process how much of a jerk I was and be able to self-reflect, learn and grow from the experience, and then I can come back even better and stronger and be a better admin when things get better for me. There is no excuse for the way I acted. I have a lot of medical issues, yes. A lot of those medical issues mess with my brain chemistry, yes. There are some times where I'm not fully conscious of the comments that I make being potentially hurtful to others, because I'm a tell it how it is type of person, and I was going along with the flow of the conversation, and I didn't intend to make it seem like I was questioning them. It doesn't matter if they were non-binary, he, she, they, trans, whatever. It doesn't matter to me. It doesn't matter to me, but it does matter to others. And I did not intend for any harm to come from the comment at all, but it did harm some people's feelings. So I have a lot of time to think about how I'm going to come back and apologize and be very respectful to the person that was a newcomer that saw the worst of me for the very first time. I'm completely appalled at my own behavior. I am my own worst enemy. I am so empathetic, and it really sucks. It really sucks that I was so appalling to some, and I'm very, like, I'm about to cry here. Like, I take it to heart. I do not want to hurt anybody, and I didn't mean it in that kind of way. But I am taking accountability for what I said, and I am going to do my best to correct it and apologize profusely, and I'm going to come back a better person. I just need to take care of myself first right now, so I can be that better person and bigger person than I have been. I've been very hurtful, so I can't wait to get back on the right foot with my Ray family at some point. That point is just not right now, because I have way too much going on, and I know when it's not a good time for me to try and be a friend to people. I have to recognize when I am being a crappy person, and I need to be accountable for my actions, and I needed to remove myself from the situation, at least for the meantime, so those people can hopefully get to enjoy the group without anybody being a jerk like me. I'm gonna go wash my hands again. Right back. Okay, so I washed my hands so I can swap out my loading needle syringe. Alright, so now I just need to transfer this to this. Well, let me get a little bit of this push to the tip. There we go. Now I can put that on, twist it, and then shove this loading needle in correctly, like that. See how it fits perfectly. And then turns, and then I go and tighten this all the way down. Wow, I pushed it all the way down. Okay. I don't remember it ever doing that. I feel like the spring is broken or something. Hmm. It says make sure you can see it in the little window right there, and I can see the little thing. So, all right. Should be infusing now. See, I'm at 40 mil. Whew. So, anyway, onto my tough conversation I was having. I acted poorly, and I feel bad. And I really hope to make things better when I return. To the Ray family when it's appropriate, whenever that it will be. I don't know how long that will take. I just know that I wasn't cool. It wasn't cool at all for me to be that way. Oh man, I'm so tired. I just want to go to sleep. I can't. It's not like I can leave these stupid things on either. I have to take them out once I'm done infusing. But 20 milliliters down, 40 to go. I'm almost to the halfway point. So 10 more milliliters and I'm halfway there. So it took me 30 minutes to infuse 20 milliliters. So yeah, we'll see how long it takes to infuse the last little bit. So tired. But I'm going to go ahead and post this video. It's a long video. You might want to watch it in like 1 to 2 times to show how fast and how long it takes to set everything up. Like I said, 35 minutes is where it took me to from beginning to end of setting everything up to starting the infusion. And then 30 minutes after that, it took me that long to get 20 milliliters infused. So yeah, that's where we're at. We're at an hour now because I just swapped out the loading syringes, and now it's just time to really just relax and watch some TV, post this video, and post the one that went wrong. I think I did the best at explaining that one, except for the syringe part. So I'm going to make sure to put warning on this is the wrong way to infuse. Don't do this. And today's video that I'm just now about to finish up is the right way to infuse. So I'm going to post 2 videos, and I hope you all have a fantastic evening. Hope you learn something from me. Don't be inconsiderate of other people's feelings when it comes to certain terminology, and don't ask certain questions that can be offensive to people that are very new to the group chat and are also part of the alphabet soup. I mean, I'm not saying that in a derogatory way either. It's just I can't keep track of how many different like terms there are for the alternative identifying people. alphabet soup is just easy for me to say, sorry. But no harm, or I do not intend to say it in any kind of derogatory manner. I mean, look at my hat. I am a proponent of people loving everybody however they want to love each other. Love each other no matter what, no matter who you are or what you identify as. It doesn't matter. What matters is what you think of yourself and how other people treat you, how you treat yourself, and how you treat others. So I hope everybody has learned something from me and my mistake of what I made and my accountability of removing myself from an admin should not be that kind of person. And so I removed myself from the situation. I accept what I did was wrong. I don't know if I'll ever be an admin or moderator again, just because if I have lost my cool like twice and had some incidents happen recently in my group, they just know that I've been struggling really hard and I'm very misunderstood. And people just don't have quite enough time to get to know me on that deeper level, to understand or try to understand where I'm coming from. It takes a long time, and not everybody's going to understand, and I understand that. Not everybody's going to understand me. And the right person will come along that will want to understand me and get to know every part of me. No matter the mistakes I make. I'm only human. I am not perfect by any means. Nobody is. We all are crazy in our own ways. It's just being able to recognize and having the awareness of when you are doing things that are not approved by society, I guess is a good way to put it. Brain fog. Couldn't think of any other terminology at the moment. So anyways, I'm going to wrap this up. I'm going to wrap this up and show you guys the finger painting I did. And I think I already showed it in one of my other videos. I painted that. I'm really proud of that. And I hung it up today. That painting. I really love my painting. So I hope everybody else has a fantastic rest of your week. Happy hump day. Because it's going to be hump day by the time I'm done infusing. This is going to be Wednesday. I'm going to go up and have x-rays done tomorrow. I'm going to ride with my mom, and she don't like to mess around. She likes to get going as soon as possible in the morning. She likes to just whoop. And she don't have time for my disabled slow butt. So I got to make sure I go to bed right after I infuse. And yeah, I'm so ready for sleep. I'm so ready for bed. I wish I could sleep now, honestly. It's barely moved. I've done 5 milliliters in 10 minutes. This thing is slow as F. So, anyways, I love you all. Thank you for watching. Thank you for getting to know me. Thank you for watching and learning about IGG Infusion. It's complicated. So complicated. That's why this video is so long. This is how you infuse IgG Immune Globulin. And I told a little story about what's been going on in my life lately and how I own up to my mistakes, man. Being accountable and owning it, okay? I will do better, and maybe I'll even try and do some kind of event or go to a pride event or whatever it is to try and redeem my karma for doing what I did and being very not right. Not right with my conversation. So I love you all. Have a wonderful, wonderful week. Have a wonderful day. Have a wonderful night whenever you're watching this. If you could comment and let me know what you think. What other videos do you want me to continue doing? Do you enjoy my dash cams at all? I don't see the numbers very high on my dash cams. Seems like everybody loves these getting ready with me or chilling with me or unwind with me. I'll add all those hashtags to this one because this is part of my unwind with me. I'm too tired to be moving around a whole bunch to do my face cleansing and stuff, but I am still going to do that tonight. It's just got to be a separate video if I do one. If I do another one, I'm kind of videoed out from today with my admin video and now this one. All right. Well, I love you all. Please tell those that you love them, because you never know when the last opportunity will be that you can tell them. So make sure to tell everybody you love them and keep trying. Never give up. Always advocate for yourself. You can change things. Your body is always changing and it's always trying to find a balance. And it's up to you to listen to your brain and your body. And it's telling you what you need to know. It's up to you to listen. So listen to your body, listen to yourself, listen to your brain, and be happy for yourself. Be happy because only you can change your feelings. So feel your feelings. Smiling is contagious. Smile as much as you can because you never know what kind of day somebody's having. So just a simple smile or a compliment can really help somebody's day. So if you got a compliment for me, hook me up, comment me, comment a compliment my hat, compliment my awesome sports bra. I don't know, man. my badass pants. I love my raver type pants. This is my big raver pants, but I like the waistline that I'm able to unbutton and unzip part of them, and I can still do my infusions. So I didn't have to get like half naked in order to get this infusion done today. My next infusion is with my nurse, and so I can't be recording my next infusion. I don't want to include my nurse in it. She would maybe be okay with me filming it, but she wouldn't want to be in it at all. I know that. So, anyways, thank you all for joining me, and have a fantastic day, night, whatever. Peace out.